morning. We are in the verge of a healthcare revolution. So isn't it pretty amazing that any one of us can today measure our health and wellness accurately at home without going to the doctor's office? So totally ubiquitous activity and exercise measuring with your mobile phone. It's easy. Getting your medical grade ECG measured with your mobile phone. Of course you can do that. And you can even get your genome sequenced by spinning in a tube and sending it over to 23andMe and Monaview. So the data is not the problem anymore. We at Health Puzzle, we think the problem is that there are not good enough services to turn those mountains of health data into healthy actions because the data doesn't translate into action by itself. Therefore, Health Puzzle is soon launching the first mobile application of ours called You that offers its users a variety of what we call healthy engaging challenges that leverage the automatically tracked health data in a meaningful way. So you can think about a challenge as a social gamified tool or a format for behavior change. Challenges can be built around various different topics of health, increasing your activity, running a half marathon, getting more sleep, intro to paleo diet, you name it. It's kind of highly customizable format. We're going to partner with the best health and wellness pros who will provide us with the content. Our team will build some of the challenges, but we want to have most of the content from outside. In the future, your doctor will also be able to prescribe these challenges. In addition, we have an algorithm built in our application that enables us to recommend and prioritize these challenges for the user based on the relevance of that challenge for that particular user. And this relevance score leverages the preference data, the health history data, as well as, if the user so desires, also the genetic data of that person. So it gets really kind of personalized as an experience. So we are You and Health Puzzle, and we will turn health data into healthy actions. Thanks for your attention.
Bill, you want to dive in?
Okay, sure.
First question.
So I almost got it, right? So you started out saying there's this vast amount of data, and so I thought you were going to lead me down this, data analytics, feedback, we take all that diverse data, and then I got lost because you're doing challenges, and then at the very end, I think maybe you pulled it together. I'm not sure. Is that what you're doing? So you have all this data from Fitbit and from 23andMe and from Mia Logger and from Latori. You take all that data, and then you say, because you are who you are, hence the name, we recommend the following 3 challenges. Is that where you're going?
That's one way of how we use the data. However, we use the automatically tracked health data as a kind of fuel for helping people change their behavior, to get what gamification or game builders called instant reward mechanisms to the challenges. So we kind of use that as a fuel in the challenges.
Can you give us a really quick, compelling example?
So say if there was
data leads to recommendation, leads to challenge, leads to outcome, right?
So well, basically, if we think about the data as the fuel for the challenges, for kind of supporting behavior change, this can be like if there is a task card in our challenge that run around the convention center, you wouldn't need to tell us that you ran around the convention center because of course we know it because you have your mobile phone. So kind of we leverage the automatically tracked data as much as possible because the focus shouldn't be on tracking, it should be in action. And the other way we use the data is in the kind of the recommendation algorithm where we say we take your genetic risk profile. For me, it's I have high risk to obesity, actually, to cardio, to coronary heart disease, as well as diabetes too. So we take that information, and that helps us to kind of recommend you the challenges that most probably, keep you in good health. That's another example.
Michelle?
Not sort of knowing as much as I obviously should about medicine, but it just sounds like that you are tackling sort of just a humongously large thing, and to come out with sort of recommendations that are actually factual and good takes everything into consideration of the person in question, and actually is then sort of sound medical or lifestyle advice, seems like a very, very tall order challenge. And I'm not maybe questioning that it couldn't be done. It's more like that the way you approach this from a very high level of you know, we will change the world here now with all this data, just seems quite big, which I commend you for.
Yeah.
Is that feedback or a question?
Yes. We'll give a 3.5-minute product demo tomorrow at 11:25 here. So you will get the first kind of sneak preview of the application. You will see that it's not difficult. It's kind of you pick a challenge, you invite your friends, and you start doing it. It's not, you know, you don't have to know about the complex stuff that's going on, you know, underneath. That's kind of, you know, for the consumer, it's just kind of, you know, it seems like a fun kind of, you know, gamified health enhancing experience.
Yeah. Mike?
I was going to say maybe it'd be something to think about is to focus on, you know, a certain demographic, you know, maybe working women in their, you know, early 30s or something, to really focus on that, you know, to build on that first, to kind of narrow it down, just, you know, thinking about what the other panelists were saying.
Yeah, that's a great advice. Thanks.
So, hi David. So this is David Lindemann, Director of Citrus.
Should be apologizing
It's
to
okay.
folks.
With some traffic, I'm sure.
Yes.
Yeah. All right, Eddie, do you want to add something?
Yeah. I can see that this is a very grand vision, that you are using genetic testing for predisposition, and you are also doing activity tracking. But in the recommendation, in the challenges, those should be challenges to help them improve their health, right? How can we close the loop? How can we find out whether would one who actually takes on the challenges and accomplish it actually become healthier? Do you have some metrics to measure that, to encourage?
Yeah, that's a great question. So it depends on what kind of, you know, what kind of sensors or applications or kind of or things to be measured are attached to the challenges. So you know, we can definitely, by the, at least from the automated activity and exercise logging that we have, we can kind of, you know, get some kind of, you know, verification if some change has been happening. If you integrate it with some other markers, say if this is done in collaboration with a clinic, of course you can go on, you know, get your, you know, blood tested or so, you know, to kind of verify the result.
Do we have any additional feedback? Bill, do you want to add something?
Sure. I mean, just following up on kind of what you're getting from the panel here, it's back to the issue of, one, being clear what it is you're doing that's unique and compelling, and you know, sort of where that intersection of compelling is, and two, how you're going to differentiate from all of the other wellness, you know, encouragement, you know, applications, and particularly, you know, since the health challenges seem to be sort of the core of your sort of unique differentiation, is a little bit more on how they're different from, you know, they're different from running around the convention center, right? Because I mean, that, you know, you need something more than that to kind of knock our socks off, I think.
Yeah. Yeah.
Okay.
The challenge is that.
This is
I'm
just
sorry.
Okay,
yeah.
this is the
You can talk
But,
more after.
and can we see the demo before tomorrow, or do we have to wait until tomorrow?
answer tomorrow. Actually, I just noticed that I myself did a mistake. It's actually getyouapp.com.
Get you.
Well done. So getyouapp.com if you want to visit our website that launched yesterday.
Thank you.